Hey everybody, welcome to the continuing series of hospital news and leadership interviews. These interviews are a conversation with leadership of the many healthcare organizations within South Florida. And today we have a brand new CEO over at Broward Health North, Matt Garner. Matt, welcome.
Thank you.
Good to see you today, and thanks for taking time out of your busy day. I know the hospitals are real busy, especially this time of the year, to talk with us. So let's get started. So tell me your full name so people can understand who you are and the current position.
Absolutely. So my name is Matthew Garner, and I'm the Chief Executive Officer here at Broward Health North. Been in this role for about 5 months now.
Matt, tell us a little bit about, everyone comes into roles like this, but family life. Tell me a little bit about your family.
Absolutely. So my immediate family, so I am married, relatively newly married for about 2.5 years now.
I guess that's a good thing.
It is a good thing. To my wife, Ashley, who's a CRNA.
Oh.
So she currently works per diem at a number of facilities down here in South Florida, hospitals and also surgery centers. So we share that commonality, both working in the field. And
so
then
she's not going to work for you then?
Absolutely not.
No,
That's what I always tell people. They always ask where you met,
okay.
and I always let them know not working in the same hospital.
So tell me about your background, your education background.
Absolutely. So I earned my bachelor's in health services administration from the University of Central Florida. Mm-hmm. So always been on this track. Had a desire to get in the profession of health administration very early. So after I finished up my bachelor's at UCF, I got my master's degree in health administration from the University of Florida.
Oh, great.
Yep.
Great. And career-wise, social-wise, you're part of some organizations too, aren't you?
I am. So I am a fellow of the American College of Healthcare Executives. Also this year, both Charles and I are going to be on the board for ACHE of South Florida. Mm-hmm. So very excited to serve in that capacity and see how we can help cultivate the next crop of healthcare leaders down here in South Florida.
So from education to career, and part of it, and what was the reason in your mind to be able to get your fellow in the college?
You know, a lot of my mentors coming up in this profession had earned that credential. They spoke very highly about the opportunities it had afforded them. And from a professional credential standpoint within this field, it really is the standard.
It is. It is basically, it shows the top of the field.
Absolutely.
Yeah. So your career back, so you went through the schools. Now tell us some of the career path as far as employment was, because I've known you in many different places, and it's great to see you here. Mm-hmm. I'm a big fan of you being here. So tell us a little bit about your career movements from when you first started to where you are today. So
starting with when I was in graduate school, University of Florida. So the way that program was structured is between your first and second years, you do a summer administrative internship. Mm-hmm. So I got the opportunity to take one on with Tenet South Florida, down here amongst their 10 hospitals. So got to rotate at all those hospitals, had access to regional leadership. So really great experience in that regard. Yeah. So once I wrapped that up, they did give me the opportunity to come back once I finished my second year of my master's program for a 1-year administrative fellowship. So during that fellowship, I was based at Delray Medical Center, got the opportunity to get my feet wet, round through all the departments, take on special projects. And then once I wrapped that up, I got the opportunity to take on an assistant administrator role at Delray Medical Center. So really my first taste of healthcare leadership. Had 2 departments reporting to me. And then after about 7 to 8 months in that role, I got the opportunity to take on the associate administrator position over at Florida Medical Center. So the unique thing about that opportunity is the week before I started over there, the chief operating officer actually resigned.
Right, I remember that.
Yep, I feel like I've told this story a couple times.
But I do it, you didn't tell it to these people, but I remember that.
Yep, so I stepped in, it was February 1st of 2016, as essentially the interim COO, less than 2 years out of grad school. So after overseeing a lot of those COO departments for about 5 months, I did interview for the opportunity to take on the role permanently. And fortunately, I did get the chance to step into that role. So served as a chief operating officer for about 5 years over at FMC. Had some great years over there, really great experience in terms of building my foundation from a healthcare leadership standpoint. And then beginning of 2021, I took on the role as the chief executive officer over at North Shore Medical Center in North Miami. So spent about a year and a half there, went through an ownership transition.
Which was always challenging.
It's always challenging. And, when I got the opportunity to speak with Broward about some openings that they had, I'd really watched the trajectory of the organization over the last 5 years.
Right.
And I feel that they have a lot of momentum at this point. So I jumped at the opportunity and initially was offered a different position, but did get the chance to step in here at Broward Health North as the interim CEO before taking it on permanently. So It's been a great ride.
Well, Broward Health in the last few years have really developed into some great leadership at the top.
Yep.
Starting with Shane, really great leadership. That really knows about healthcare.
Yeah, absolutely. Great. You're absolutely right. So Shane has been a bundle of energy, bundle of positive energy, really contributed to the positive momentum that Broward Health has in the market. And, somebody that I work very closely at the top within Broward Health is Alan Whaley, the new Chief Operating Officer.
New guy. Met him a couple of times. He's a new guy, but he's a great guy.
Yeah, new to market, not new to healthcare leadership. Comes from University of South Alabama. So given his experience, he's been a great resource and a great mentor for me starting out over here.
Well, it's good to bring somebody in also from the outside sometimes to be able to kind of bring in new ideas.
Fresh perspective.
Absolutely. So during your career and movement, you're very young to be in this position. By the way,
yep,
very very young.
Thanks,
but it's good. So probably feel old now. Anyway, but what are some of the major challenges that you faced during your career? You went through obviously your COO positions, the COVID situation.
Yep.
Not here, but in other, and we're not out of it yet. But you went through some COVID. So what was some of the challenge you had, besides COVID, maybe others, through your career so far?
I kind of break it off into two separate categories. So I'd say professionally, to your point about me being younger for this role, that is feedback that I do hear from the staff whenever I've joined a new hospital. But
you may be the youngest one on the staff, as a matter of fact.
Yeah, so, in some instances, but it's a matter of proving that you're competent in the role, that you have the confidence to pull it off. And you kind of build up that credibility with your teams over time. So that was definitely a challenge as I was coming up through the ranks.
Sure.
Because simply put, you don't know what you don't know.
Right.
So you have to be willing to ask those questions and build that confidence with your teams. And I would say since last time we spoke, the other challenge that I think I've faced is adapting to new systems. Mm-hmm. Keep in mind that I was with Tenet for about 8 years.
Right.
So that was really all I knew right out of grad school. So I went through the transition to Steward Healthcare, which I worked with for about a year, and then now Broward Health for the last 5 months. So, not a negative thing, but definitely challenging coming into a new organization, learning the nuances of how they operate. Some things are constant in healthcare, but, whenever you switch an organization, you have to make some adjustments. Right. So that's been a little bit challenging.
Well, you got IT adjustments, you got culture adjustments too.
Without a doubt. So you have to get an understanding of the situation that you're coming into and adapt accordingly. So, and then to your point about COVID, now, I know that a lot of the other subjects of your interviews have spoken about the challenges they face with COVID. So that was definitely an interesting time for us. Obviously not completely out of the woods with that one yet. But again, I think that really just reinforced the need to be flexible in healthcare, the need to be out there to have open communication with your teams because it was a very challenging time for all of us. So that's the best you can do sometimes. Yeah,
and everyone who I've spoken to over the interviews, the 30 or so interviews I've done, every one of them have always said that it was a challenge, but it was amazing how people who you wouldn't think stepped up did step up.
Absolutely.
And sometimes the people you think would step up didn't step up. It was really kind of an eye-opening event.
Yeah, and even the opportunity to step out of what I'd call traditional roles.
Right.
You might have one leader that oversees one department step out into taking on additional responsibilities just to meet that need that we have. So, it really showed how resilient our teams are and showed how great of a team effort we can do when we all band together. So even across different systems.
Oh, absolutely.
We saw a lot of intercompany collaboration.
Well, you did. I know from South Florida, all the hospital systems did get together to try to work with each other.
They did.
If you had something that the other one didn't, you shared, especially with the vaccines or masks or equipment or PPE. So it was really good down here. I'm not sure about the rest of the country, but everyone really band together. You're right, band together down here.
Absolutely agree.
So what does your typical day look like as a CEO?
So again, Never a typical day.
Everyone does. Never a typical day. Somebody said to me, Charles, you can't use that term. I said, well, I understand that, but some things are constant within the day. You get at a certain hour, you go over some stuff, and then everything hits the fan.
Absolutely.
So, but on a day that the fan is slow and it doesn't hit that bad, what does your day look like?
So some constants that I have in my days. So each day we have our daily safety huddle, which starts at 8:30. All of our department level leaders attend that via Teams, and it's kind of like a stoplight report. So we go through some of the main issues that are coming up in each of the departments. If there's nothing going on, leader reports as such. So it's really the pace setting meeting that kind of lays out how the rest of the day is going to go. Other standing meetings that I have throughout the week, very fortunate to have the opportunity to meet with my counterparts, the other CEOs of Broward Health each Tuesday morning. We meet with the system COO and talk about different strategic things we're working on, different operational opportunities that we've identified. And we also have a CEO strategy meeting with the CEO of Broward Health as well on those Tuesdays. So those are some constants. And then can always expect at least one medical staff leadership or committee meeting each week. And then, this is something new that I've tried to stick to. But throughout the week, I try to keep it to only 2 to 3 community or after hours events. So that's something new that I'm working on.
Community events are tough within a hospital because you really rely on the community and they all want a piece of you.
Yeah, you're absolutely
Everybody
right.
wants a piece of Mac. There's no question about it. So it's really controlled access.
Yeah, and from a community engagement standpoint, I know that you were at our last Community Relations Council, and that's been a really big focus of ours. So we actually convened a group that meets monthly that focuses in on different community opportunities, community involvement opportunities that are out there. So for instance, this past weekend, we participated in an event called Unity in the Community over in Pompano Beach. Great attendance over there. I'd say 2,000 to 3,000 people came out.
Wow.
Got the opportunity to pass out about 500 of these Broward Health branded bags. So definitely let our presence be felt out there. So we're looking for more and more of those opportunities. And as needed, we will delegate to different team members.
I was about to say, you can't be everywhere.
Not every single one.
But you have good teams and they're out in the community. Like you said, you probably do as many events out of here than most hospitals do. I mean, but again, you can't beat all of them, or else you'd never be able to run the hospital.
Exactly. But, we have a great team over here. So everybody's been willing to pitch in. We had great attendance from our department leaders at that event this past weekend. So it was really nice.
That's great. So you came through different organizations, school-wise. Who were some of your mentors? And you can either mention them by name or mention them by what they were.
So I'd say that the general trend that you'll see amongst who I'd classify as my official mentors is that most of them were my bosses.
Right.
Like for instance, my first boss starting out with Tenet was Trey Absher. He mentored me along the way through my fellowship, my first couple positions with Tenet. And then Jeff Welch was my next boss over there, a very well-known healthcare leader down here in this community. And, both of those leaders taught me something different about the way that I have kind of formed my own style.
Right.
So those were two of the first ones that come to mind. Of course, can't forget Marsha Powers.
Right.
She was really the one that started up the training program that I started out in. So she gave me the opportunity. She took the chance, and they gave me these larger and larger responsibilities as I kind of ascended within the Tenet structure.
That's great. I mean, you really have to have mentors and people, who are watching this, maybe students or whatever, people coming up through middle management, lower management. You got to hook onto it. You got to find that right mentor.
You do.
And not necessarily everything the mentor does is right, or you absorb.
Yeah.
You hope you absorb the good and not the bad.
Yeah, and I think others have told you this as well. You learn as much from the negative experiences, although, you obviously want to minimize those, but you learn about how you don't want to lead through some of those experiences.
Sure.
So all those experiences are very important in terms of shaping someone's overall leadership style.
That's great. So in the past year's challenges, again, going back to the COVID situation, because I love talking about COVID, and it's never going to go away. It's kind of like the topic of the day. What influenced any philosophies that you had relating to that, as far as being able to change things the way, in other words, because of the COVID situation, have you changed style? Have you changed ways you've done something, learned from it philosophy change of dealing with people, dealing with situations.
I think if anything, it's reinforced two main things for me. First of which is that people really are our most important asset in the organization. I think everybody throughout the healthcare industry is facing these staffing shortages. So when I say that people are our most important asset, they're the ones that are really driving everything we do. They're delivering the high quality care. They're delivering the positive patient experience. And it's so important that we're retaining those individuals that are really driving that for us. So they really are our most important asset. And to really focus in on that, we have ramped up the number of employee engagement type activities that we're doing here at North specifically. So making it a point to get out there and round on our staff consistently, celebrating all the holidays. I think, for instance, one of my favorite events that we've done over here was actually a holiday concert, and it really got some positive energy flowing throughout the facility. So the staff loves to see that. They love to get the opportunity to showcase their talents and engage with their fellow coworkers. So that's been a really big focus for us. And then the second thing, again, it's another reinforcement piece.
Absolutely.
Is throughout the pandemic, we were changing our protocols and making sure that we're adjusting as needed. But again, I think that as long as you're framing everything that you're doing within the hospitals based on what's the best thing for the patient, that you can never go wrong.
Right. No, absolutely. But things have changed. I mean, healthcare delivery has changed somewhat because of it. And in a good way, So to people who are younger than you, which aren't many, people who are younger than you, and pursuing a career in healthcare, what one piece or two pieces of advice would you give them as they try to maneuver through the system?
I would say absolutely go for it. It's such a dynamic industry, whether you're looking to get in on the clinical side, whether you're looking to get in on the administrative side, you have the opportunity to make a difference in people's lives. And if you have a passion to positively influence people's lives, then this is really the most fulfilling profession you can choose. In terms of seeking out opportunities for growth, if you want to go, let's say, the administrative route like I did, relationships are the most important thing in this industry. I've seen it time and time again where no matter what organization you're with, now that I'm with Broward, a lot of people that I worked with previously over at Tenet have come over here too. So it really just shows how small the healthcare world is. And especially when you're down here in South Florida, it seems like everybody knows everybody or, has some experience with somebody else. So those relationships are most important and you can never burn a bridge.
Yeah, if you're in the South Florida market, you better get to know everybody everywhere. Because one day you're going to be working with them. You may not think so, but one day you'll be working with them.
Yep, you are.
So as one might say, don't burn the bridges. Don't burn the bridges.
So those relationships are huge.
Absolutely. So finally, this is also one of my good questions, is what kind of keeps you up at night? As a CEO, you have so much responsibility. So many people are relying on you. Like, how many people do you have working at this hospital?
About 1,500.
15. So 1,500 people are always looking at you. So what keeps you up at night?
What keeps me up at night? I would say the competition to retain that talent, like I spoke about before, and recruit in ways that we didn't before. Since people are the basis of everything that we do here, if we're not able to maintain that foundation of good people to support what we're doing, then what are we? So thinking through different ways, how we can retain those people, how we can pull them in ways that we hadn't before, is something that I spend a lot of time thinking about and has produced some sleepless nights for me, amongst other things.
Not many. I mean, I guess it's gotten better since we went out of the pandemic, main pandemic.
Yeah.
During the pandemic, I don't think any CEO ever slept. So.
Yeah, no, I think you're absolutely right. But it has produced some different ways of approaching it for us. Like, for instance, this morning we had a number of nursing students from our local schools that were in here that were interested in nursing externships. So we're looking at different ways to pull in talent into the pipeline very early in the game to make sure that they have a good sense of who we are here at Broward Health North, because I have to say one of the best things about this hospital has been the culture ever since I've started. You walk these hallways and the teams are very engaging with you. So if we're able to bring those students in very early, we're able to show them positive experience and able to get them integrated with our teams, I think that there's a good chance we may be able to pull them in post-graduation and keep that that family feel within the hospital.
Yeah, it's kind of what you did when you kind of interned in there, kind of matriculated
exactly
through the organization.
Right,
and great.
And as I was sitting there speaking with the group this morning, that's exactly what I thought about. I was like, my experience
You've been
was
there.
was somewhat similar from the administrative track versus clinical track.
Right.
So.
Yeah. Well, Matt, I appreciate you taking your time. I know you're a busy guy. It's in the afternoon, and I know you got a lot to do. So I want to thank you for being on with us.
Absolutely.
And I'm sure we'll run into each other at least board meetings.
Yep.
Well, it's good to see you.
Thanks, Charles.